Hi everybody, today I'm going to talk to you about a treatment that we perform here at the clinic called cryotherapy. Cryotherapy is delivered from a handheld device called the CryoPen, and we use this to deliver nitrous oxide to essentially freeze any benign lesion. What essentially happens is the deliver of nitrous oxide to the lesion freezes the lesion, causes shards to form, which then burst through the cell membrane and essentially cause cell necrosis, cell death, and eradicate the lesion. Lesions will react differently depending on the type of lesion, the size of the lesion, and your ability to heal. What to expect during your treatment. You will come in to see me at the clinic for a consultation. If we are to proceed with the treatment, it's a relatively quick procedure to perform the cryotherapy. We cleanse the area and then essentially we measure the lesion to determine how many seconds we will freeze for. We will freeze the lesion, we'll let the lesion thaw, and then we do a second round. You will immediately see a red ring around the area that we have treated. This is a histamine reaction and is perfectly normal. It's very important that for the following 48 hours post-treatment, you don't take any antihistamines. We need to allow the histamine reaction to take place. Every lesion reacts slightly different. The majority of lesions you might find that they'll maybe go a little bit darker in colour, dark brown, black. This is perfectly normal. You might get a bit of scabbing, you might get a bit of crusting. If you do, it's important that you don't pick it. If it becomes itchy and uncomfortable, good old Vaseline around the area will just help relieve that. A blister may form. If a blister is to form, this will tend to happen 2 hours to 2 days post-treatment. Blisters can often look more severe than what they are, can be a little bit painful for a couple of days, but the most important thing with a blister is that we don't allow it to burst or pop. If this is to happen with a blister, the most important thing is hygiene. We need to keep the area clean. It's quite easy to look after that. We just cool boiled water with some salt from the kettle, dab the area twice a day, and you can use a little bit of Germaline around the area just to keep it clean. Following your treatment, we will book you back in for inspection. This is usually between the 2-week to the 4-week mark. From there, you will come back and see me and we will have a discussion to see how you've got on with your lesion. Some people are happy with it being greatly reduced. Others will look for full removal. More often than not, lesions will take more than one session to fully remove. We look forward to seeing you here at the clinic and we'll get you booked in for your lesion removal.